Welcome to Patient Matters, where we dive deep into the world of plastic surgery. I'm your host, Dr. James Southwell Keeley. In this series, we will engage in candid conversations with patients, specialist doctors, nurses, and others who have shaped this journey. Together, we will explore the realities of plastic surgery, covering everything from safe practices and patient recovery stories to the latest techniques and the artistry behind the craft. We'll also discuss governing bodies, address botched and revision surgeries, as well as share simulated consultations, all aimed at guiding you through your own plastic surgery journey. With decades of experience, I'm proud to be a member of ASPS and the Royal Australasian College of Surgeons. I serve as a plastic surgeon at St Vincent's Hospital in Sydney. Join us as we unravel the complexities and beauty of plastic surgery, one episode at a time. Welcome, and thank you for tuning in. I'm your host, Dr. James Southwell Keeley, and this is Patient Matters. In Patient Matters, we discuss the thing that I'm most passionate about, namely plastic surgery. We'll be delving into clinical situations and patient scenarios that I've encountered working in the field for nearly 20 years. Shortly, I will introduce Kaylee, and we'll discuss keeping up appearances in the workplace and what that means for both women and men working in corporate Australia today. Welcome, Kaylee. Now, Kaylee, we're going to discuss, amongst other things, your career, which has involved working both in banking and now in property.
That's right. Thank you for having me.
Absolute pleasure. Thank you so much for coming along.
No problems. I guess to give a summary of my corporate background, I currently work in property as an associate director. But prior to that, I spent 20 years working in investment banking. Mm-hmm. So got a lot of experience in both of those industries and how times have changed over the last 20 years.
How have they changed over the last 20 years?
Obviously, there's a far greater number of women in the workforce, which is amazing to see. But I think the equality between men and women and how we're treated, how we're paid, that has definitely changed. And also seeing women in senior executive positions. Yeah. Because that just wasn't a thing 20 years ago. Yeah.
And do you think, so it sounds like the change is for the better on the whole, but has there been enough change?
Definitely the change is good, but there's still a long way to go. Yeah. And I think there's a huge amount of young women graduating from uni who'll be going into the workforce who will be expecting, it to be equal, and it's just not quite there yet.
And does that inequality manifest in pressure, do you feel, for women and or men trying to gain career advancement?
Pressure, yes, but I guess it's the expectation that women place on themselves. Mm-hmm. We do feel the need to work harder, to push harder, and obviously to look younger, better, more successful. All of those things come into play.
So there was a really interesting statistic from the American College of Plastic Surgeons. It's a few years old, from 2019, but I think it's still valid. And that is that 13% of people seeking cosmetic procedures were doing so for career advancement.
I mean, does that number sound low? Maybe. But I think career advancement is definitely a part of the reason. It may not be the sole reason, but it would definitely play a factor in the decision to get plastic surgery.
So I would agree with your summary. I think that is an underestimation, and it may have been true 5 years ago in 2019. My impression is it's far greater today, and of course there'd probably be a reporting bias there. Who's to say that everyone who's presenting for a non-surgical or a surgical plastic procedure will actually be able to either enunciate that, the reason they're having it is to help them with their career progression, or maybe they don't want to admit it.
Absolutely. And I think it's not like you're going to go and get plastic surgery for a promotion. It's more that you want to look a certain way, whether that's more youthful or more polished, and that will actually help you to be respected to gain more credibility. And then obviously that could then lead into said promotion.
Have you ever personally felt pressure to do such a thing, to have a Botox or filler injection? Have you thought, this upcoming interview for that potential position, I could tip that balance in my favour if I did that?
Probably not in such specific terms. For example, like the team that I have at the moment, the average age is 25.
Yeah.
I'm 48.
Yeah.
So I'm
That's
old
a
enough to be
frank
their
admission.
mother. So, the contrast between how they look and how I look is obviously very apparent to me.
Yeah.
They may not notice it, but to me, I feel it. I feel it every time I look in the mirror.
Yeah.
That I think, I just need to get a little bit of a touch up, just so I look my best and feel my best. I think most of the reason I get, Botox or filler or anything like that is because of how I feel.
Yeah.
It increases my self-confidence, which then helps how I perform in the workplace.
Yeah. Interesting. So no pressure from above for these sort of interventions. What about peer group pressure from people at your level within the workplace?
Obviously, definitely not from the men, because men seem to be able to wear what they want, look the way they want, have their beer guts or whatever. No judgment, but that is not seen as a detractor from their career. No, I think it's more an internal, like a personal thing that as I said, I think if I look better, I have more confidence in myself and my ability, which sounds really shallow, I know, but I think it just does give me that extra, pep in my step.
Good on you. And look, from a personal perspective, I don't think it does sound shallow. And there is a direct relationship between how we see ourselves and how we feel about ourselves. That is undeniable. So I guess you're just stating that as a fact. We'll touch upon the men again in a moment, because you did mention the beer guts.
Oops.
Yeah, no, that's good. We'll come back to that. What about the younger women? So in your team you have 25-year-olds. Are any of the 25-year-olds having Botox or filler treatments?
Look, potentially. But given they're so young, it would be more preventative. I did have an assistant who actually worked for me a couple of years ago. She was 23. She'd had her breasts done, her chin done. She'd had liposuction, full Barbie Botox, lip fillers, eyelash extensions, hair extensions, the lot.
Yep.
And it was way too much.
Yeah.
Like that was an overcompensation for something.
Yeah.
And I think when people go that far, it's not even attractive anymore. But
it's a tricky line, isn't it?
yeah, and she had no one respected her.
Yeah.
They just looked at her as a bit of a freak show, to be really blunt.
Poor thing. So I think there's obviously some drivers there, that there's personality types, and they're either running away from something or towards something, but they're probably not really happy in their own skin.
100%.
And I guess as a practitioner, I've got to be constantly aware that I'm not pandering to those sort of personality types and offering them really stage advice and trying to temper that desire to overdo things. And look, I could say no to 10 people like that and only get cut through to one. The other 9 will go out and find someone in the city or the country who will do what they want to have done. And I can't change that. But I think as a society, it's probably a good thing for us just to be aware of that. As you've said, there's something driving that, and it's not a healthy drive.
No, and I don't think I think that was a detractor to her career rather than a promoter.
Yeah. Yeah, so you can do too much.
You definitely can.
And my whole thing is being natural. So if you look like you've had something done, then you haven't had it done well. If no one can really tell, you just look like a great version of you and you're happy in your skin, then I think my job's done, and I'm really delighted when we can get to that point.
Yeah, and I think I'm probably far too honest. A lot of the girls in my team are like, "Oh, I can't believe you're 48. You look so good," and I'm like, "Oh, it's Botox and fillers," and they're like, "Oh, really?" I'm
Yeah.
like, "Yeah,
Where do I sign up?
yeah." It's like I'm just honest about it.
Yeah.
I'm happy with how I look. I mean, I'm sure you've got tips for all the different things I can get done. We'll come back to that later, though. But I'm happy with the work that I've had done, and yes, I'm 48. I'm not 25. I'm never going to look 25.
Yeah.
And I'm just doing my best to be able to put my best self forward.
Yeah. I think we haven't mentioned social media yet, but outside your team of 25-year-olds, there are thousands or tens of thousands of people that they would be looking at every day on their phones, mobile devices, tablets, that would also be influencing them.
Absolutely. You're surrounded by these images of perfection. But then when people do get work, they kind of tend to all look the same. They look like the Instagram filter.
Yeah.
And you still want the ability to be unique.
Yeah.
And to be uniquely you and to look like yourself. But the pressure that's coming in from every side with social media it's next level.
Yeah, it is next level. I mean, the algorithms and the filters and the this and the that go to manipulate the final image that's presented, and that final image is presented might be one of multiple that were taken until that perfect light angle, etc., was achieved, and then the image is buffed up, and then it's sent out. And, you know, the recipients of that image, the influence that incurs upon them is unfair. It's an unfair fight.
It is. And it's almost a narcissistic existence. I don't remember 30 years ago people going around taking photos of themselves.
No, but we didn't all have cameras in our pockets.
No, exactly. And, obviously then with COVID, we're all sitting there looking at ourselves on Zoom or on Teams. And honestly, it was pretty confronting.
Yeah.
And so the last thing I wanted to be doing is going around taking 1,000 photos of myself. Some days I don't even like looking in the mirror. I look at myself and think, who is this old lady?
I'm sure that's not the truth, Kaylee. So, COVID was incredible. The amount of people I've seen since COVID, and that includes older gentlemen in the workplace who've sat there looking at themselves in board meetings for the past 2-3 years, and then they've realised that that's the way I look. They would glance at themselves in the mirror occasionally. Obviously, when you're shaving, you notice you've got a jowly neck, but you don't really focus on it. Whereas you're sitting there for an hour plus in your meeting and that's all you're seeing, that has tipped that age group towards seeking out corrective procedures. And really at that age, they're beyond what you can help with Botox and fillers. It's not a maintenance, it's really a restorative procedure.
Like surgery.
That's surgery, yeah. Botox and fillers are wonderful up to a point. And then the good practitioners know when they've reached the end point of what those options can improve upon or can provide. And then you need to pivot to surgery. And it doesn't mean you have to do something dramatic, but you need to start engaging with that side of that equation rather than just pushing further and further down the non-surgical pathway. Because that's when you start to dilate and inflate parts of your face that shouldn't be, and then your whole appearance changes.
Yeah. Do you find that you get many men or women coming in sort of after that COVID thing to say, right, this is...
Yeah.
I really need to go the surgery level.
100%.
And have they done the Botox and stuff in the past, or if they've just gone straight?
Yeah, so the younger ones have, the older ones haven't. And these are gentlemen who would never have thought that they would ever be having that discussion with someone like me, and yet we're having that discussion. And they often ponder it and they go away and they think about it, but it only takes 1 or 2 more Zooms and they're back and they want to action the plan. Yeah.
Too much time looking at themselves.
Too much time looking at themselves. There's probably something in that for all of us. Absolutely. Now, what about the men in the workplace with the beer guts and we'll come back to them.
To be honest, I guess the generation of the guys that I work with are probably more like as you were saying, the older gentlemen that have never really been worried about Botox and things like that. And I don't feel like they think they need to. If they did, I can't imagine it would be for work reasons.
Yeah.
Maybe they're getting some pressure from their wife, or their kids were laughing at their wrinkles or something. But it feels like men get a bit more of a leave pass in the appearance side of corporate work.
Yeah. I'd have to agree with that. And there's
sad, but true.
probably a hangover from the fact that it was all men historically.
Well, that's it. That's it. They ruled the world. They were the majority. And now women are coming in and sort of making their place in the world. But as I said, like, I think a lot of the pressure for the way that we look comes from ourselves, internal pressure. And obviously the social media thing doesn't help. But I mean, going back maybe 10 years when I was in finance, and I remember there was a lady that I worked with, and she would have been maybe 50, but she looked quite sort of matronly, and she obviously had never had any work done. And I remember thinking, I just don't want to still be working at that age and looking like that, which is a horrible thing to say, but as a 30-year-old, you know, you're invincible. And now that I'm sort of getting to that age, I sort of think, is that what people think about me? So then I second guess myself and think, oh, maybe I just need a little touch up here.
Yeah. Wow.
And then the cycle continues.
Absolutely. I must say that men are definitely engaging in the non-surgical touch-up procedures a lot more these days. And that's part of marketing. It's also social media. The drug companies, the companies that produce the products, are just looking to expand their market. So if you're only dealing with one sex, you're only dealing with half the population. So you can double your market straight away. And the pickup, the take-up hasn't been as dramatic in men as it has in women, but it's becoming more of a thing. It's definitely becoming more of a thing. And I think that will spill into the corporate world as well. Yeah,
well, I mean, I guess it goes back to like when men, you know, start to go grey. You know, and then the Just for Men comes out and everyone goes, oh, wow, okay, that's a bit dramatic, you know. But then grey became the new black. And, you know, the grey, they silver foxes. You know, women just get old, but men get called silver foxes.
That's right.
And so they've embraced that change. But yeah, maybe the Botox is their next port of call.
I think so. And the grooming and just really trying to take care of their health. I think the beer guts of the boardroom are going to be a thing of yesteryear in the not too distant future.
We hope.
Yeah.
Because it'll be replaced by women, of course.
That's right. Well, you'd hope it would be a fairly equal mix.
Would be nice.
The best decisions get made when they're shared. That's for sure.
That's it. They say if you want something done, hire a mother. Because that woman knows how to multitask.
Yeah, so true. So true. Kaylee, let me ask you a slightly touchy question.
Okay.
Have you ever felt pressure at home to have any cosmetic procedures, injections, Botox, fillers, etc.?
Funnily enough, I'm actually supported in that. When I first got it done, my husband was like, that's really expensive. Like, that's a lot of money to, you know, every week or, every 6 weeks or whatever it was. But then I think he saw that how I felt. And now he'll be like, oh, there's a bit of movement. Maybe time to go back and see your lady. And I'm like, and I do that. Are you trying to tell me that I'm getting wrinkly? And he's like, no. I just know that you're happier when it's done.
Oh, he's on thin ice, isn't he?
He treads a very thin line. But he's totally fine with it. He knows that as I said, I feel happier when I'm done. I don't have that as I walk past a mirror. Oh, you know, God, I can't even look at myself.
Yeah.
I mean, you'll always find things that you want to improve on and change, and particularly as you get older. But no, there's definitely no pressure to get it done.
Yeah.
More support. But I guess I am concerned that my daughter sees and she knows, you know, so she's gone and had a little lip flip. that's about as much as, I'll let her get.
Yeah.
I mean, she's 18, so it's not like she's a child, but
Yeah.
I guess she sees what's on social media, and she sees that I do it too.
Yep.
So
In-house validation.
yes, which
Yeah.
I don't know if that is a great thing.
I think it's how you manage it, because it's everywhere. So I think if it's managed sensibly and you're open with her and she's open with you and it's an open and frank discussion, then you can bounce off each other and just temporize what's happening in the home environment.
Yeah, no, good advice.
Probably for the betterment of both of you.
Well, that's it.
Now, the reason I asked that slightly contentious question is a group of patients who often will pursue this sort of thing, be that non-surgical, the things we've touched upon most of all, Botox, fillers, facial resurfacing, etc., or the surgical procedures that help rejuvenate the face in particular, is the subgroup of patients where they're doing it for someone else rather than for themselves, which is not you. You're doing it for you and you've got great support from your partner, which is perfect.
Yeah.
I have to be very wary as a plastic surgeon of the new partner coming in with the spouse or the newly partnered partner who is pushing the process, not the individual who is. Yeah, it happens. And it's often quite subtle, and it's usually almost invariably the man. It's very rarely the woman for an older partner, an older man. It's usually of similar ages, the man's pushing the woman. And they'll come into the consultation together and he's the one driving the process. He's the one answering questions for her. It's quite obvious that she is just she's in the slipstream. She's just there because she's been pressured into it.
Wow.
And it's a tricky situation to negotiate. And sometimes the male gets very angry when you say, I can't be a part of this. This is not the way it goes. And usually the best way to do it is say, okay, well, we've had our initial consultation. Next time we're just going to have to meet one-on-one. And then you really dig down and you tease out from that individual what it is that is driving the process. And if actually they are keen to do it, whatever that it might be, well, I'm amenable, but you still want to meet them a few more times just to really feel them out. If they are, once they're by themselves, are not particularly interested, or you just pick up on those cues that, I don't know really why I'm here, then it's a no-go. And I feel terrible for those people because I'm not doing it, someone else will. Someone in the city will do it for them. There's always a practitioner who'll put their hand up. And that really comes down to your individual ethics and what you're prepared to stand behind and back.
Yeah, well, I guess that was gonna be a question I was going to ask you, was if someone came to you and said, I want to get a facelift because I'm going for a job promotion. Sole reason.
Yeah.
Like how would you deal with that?
I would refuse.
Point blank.
Point blank. So it's a terrible motivation to try and better your career with a surgical intervention. Or even a non-surgical one. If it's part of a process of being the best person you can be and it's something you really want to do and you tease that out over a series of consultations, then I can support that. But what if you don't get the promotion, but you've still spent all that money? Where does that leave you? Surgery, even the non-surgical procedures, are not always as they were supposed to be, and they sometimes don't go to plan. So if an unexpected outcome befalls you and the motivation was for the job, you're all over the place. You start questioning your motivation, you start questioning my motivation, it all goes to pot.
Yeah.
People die having surgery. Now, touch wood, that's never happened to me, but it happens. And if you're going for your promotion but you die in the surgical bed or on the surgical table, that is the worst outcome for you, for your family, for your friends, for everyone, and for my reputation, obviously. Yeah. So you have to have the right motivation, and then when you step forward, you have to do it in the safest environment. Everything has to be top-notch, the best hospitals, the best anaesthetists, all of that support. That's the surgical side of things. Like Botox, you can get a droopy eyelid for 6 months. Like, you think, oh, it's just Botox. But if it's done incorrectly, poorly, the wrong dose, the wrong place, you're going for that promotion with a droopy eyelid now.
That's it. There's confidence shot.
Confidence shot. The whole reason you did it. And now you're staring at me thinking, what the hell have you done? Invariably, it doesn't happen. And people are having Botox all over the city, even as we speak, this very second. And those sort of things aren't happening, but they can happen. Yeah. People go blind having fillers if it's in the wrong spot. If it's the most rare complication, but you really have to check your motivation. You totally have to be on board. You can't be doing it for someone else. The other group of people who do it for someone else are not coming in with a partner, but they're recently separated. And they're also very fragile. They're trying to repartner. They want to get back out in the singles market. They haven't been in the singles market for years.
It's a whole new world out there, apparently.
It's a whole new world out there, apparently. That's right. And they have to contend with all of this after years of having been cocooned from it.
That's terrifying.
It's terrifying. And then you've got to be very gentle with those people because they have these ideas, usually from social media, that they've got to do all of this crazy stuff. But they're vulnerable. They're often financially stressed. They've just got to tiptoe through those consultations.
So that's when your counsel comes into play and judgment call.
100%. Sometimes it's just the eyes. You know what? There's so much going on here. Let's just focus on one thing. It's a day procedure. You'll just feel so good after it. And there's limited downtime. If you like where we're going, we can keep going. But let's go slowly. Yeah, let's hasten slowly. That's a good way to go.
So starting small, I mean, obviously I've said I've had filler, Botox, lip filler. How much longer am I going to be able to continue non-surgical? I mean, the surgery thing does scare me a little bit. You know, speaking like someone who has needles shoved in my face. But the surgery thing does concern me.
Yeah.
How much longer have I got?
I'll just get out my crystal ball. And
But are we talking like, you know, can I continue to have it, you know, for 5 years? Or is it like, look, you know, by the time you get to about 60, you're not going to be able, it's just not going to work anymore.
I'm glad you came up with that number because I was going to struggle coming up with a number. 60 is not a bad number, but it's a very individual thing. It really pertains to you as an individual, your genetics, the way your collagen and the connective tissue that binds you together is aging. The aging process is skin deep all the way down to the bone. So as we get older, our bones recess. And that's part of the process that makes the soft tissue of the face descend. The soft tissue, the collagen, the elastin that kind of binds us together stretches out, kind of like an old pair of gym shorts. You know, they just don't fit as snugly as they used to.
Sounds like my face, an old pair of gym shorts.
So in that scenario, you just can't keep filling. You just can't keep filling because you start distorting the normal anatomy and you start looking different. Whereas if I can bring it back to you, you look fantastic.
Oh,
so
thanks.
whatever work you're having done is brilliant and it keeps you looking natural. If you have a good practitioner that you see, they'll know and you'll know when you reach a point where the same sort of doses that you've used for many years just aren't holding anymore. They're not getting the same cut through.
Yeah.
And as those doses and the volumes start creeping up, you've just got to be mindful there. And you can compensate for some of those age-related changes, the loss of volume, the descent of soft tissues, the recession of bone, but others you just can't.
Yeah, there's nothing worse. You see the sort of the ladies with the really puffy chipmunk cheeks, and
that's right.
That's when people go, oh, you've had work done.
Correct. Lips, massive lips, and as they get older, they get heavier, and the lip is already lengthening, and it's losing all of its normal contours, so it becomes this flat, like a roller door, and this huge kind of puffy pink at the bottom that they're trying to puff up and roll out, but it's actually working against them. That excessive weight is dragging the lip down. So actually you just need a little lip lift and then, hey, whammo.
Okay, lip lift. I've got to remember that.
Absolutely.
I'll add that to my to-do list.
Yeah, not even close. Stop it.
Yeah, nearly.
So I think then all of those procedures are available to everyone, but not everyone is aging in the same way or at the same rate. So you really have to tailor your recommendations to the individual. Surgery is definitely a big step up in terms of recovery and what it means to you. But surgery that's done well leaves you looking like you, just a younger version of you, the you that you used to remember. The nose is a little different because we do the rhinoplasty surgery to actively change the way our nose looks. So you'll instantly look different. And I think as you get older, that's a harder thing to adjust to. So a younger rhinoplasty, that's kind of where you're geared up for, and you'll have that new nose for the rest of your days.
So I've missed the boat. That's what you're telling me.
Whereas when we get older, it's one of those things you've really got to check the motivation for. Yeah.
Fair enough.
The adjustment can be a bit bumpy. Yeah. Whereas a lovely facelift just looks great. Just looks lovely. It just looks like you. Lip lift, just same sort of thing.
Better.
Eyelids. Just rejuvenated.
Rejuvenated.
Just refreshed. Yeah. I think the highest compliment a patient can pay is they feel great. They tell me, I look great, I feel great, and no one's saying anything other than, have you been on holiday?
Yeah.
What are you doing with your sleeping pattern?
That's the best comment.
That's the best comment.
You look like you've been on holiday. You look so refreshed.
Refreshed, relaxed, natural.
That's the goal.
Yeah.
Definitely.
So, Kaylee, to summarise, keeping up appearances in the workplace, it's a multifactorial event, isn't it?
Absolutely, particularly for a woman.
Yeah. So it's not just the surgical or the non-surgical procedures. It is, in fact, stepping out the door, feeling confident in the clothes you're wearing. It's your hair. It's the grooming that you undertake.
That's it. It takes hours.
It takes hours.
It takes a whole glam squad.
It does for the Kardashians.
Well, that is true. That's why they look that good.
Yeah.
But for the rest of us, the blow dry, the fake tan, the nails, the nice suit, the nice heels, it all plays into how you feel and I guess the image that you portray to the world.
Yeah. Kaylee, thank you so much for coming in today.
Thank you for having me.
On Patient Matters, we discussed keeping up appearances in the workplace. It was a difficult topic. We touched upon many different avenues and uncovered some really interesting facts. So thank you for sharing your thoughts and experiences in this space.
Thank you again.
If anyone would like to appear on Patient Matters, feel free to reach out to me through the website drjsk.com.au. That's drjsk.com.au. If you have any questions you'd like to submit, feel free to do that through the website as well. Thank you once again for joining me on Patient Matters. I look forward to seeing you in the future. Goodbye for now. This episode was researched, produced and directed by Michael Hennessy. Filming, recording and post-production by Wombat. Photography and lighting by Francisca Rauenhoff. Hair and makeup by JJ Rauenhoff. If you are thinking about undergoing plastic surgery, please make sure to consult with a qualified plastic surgeon. You can listen to more Patient Matter episodes on YouTube or follow the links on the Dr. JSK website. Thank you again for tuning in. I'm your host, Dr. James Southwell Keeley.